Okay, imagine you have served a full plate of food and your loved one eats only half of it. You tell them there's more food in the plate, but they say no, I finished whole plate. They are not lying, they are not being stubborn. They have something called hemineglect. As a neurophysiotherapist, we often hear families say he shaves only one side of his face. She applies makeup to only one side of her face. He eats food from only one side of the plate. He doesn't look at me when I stand on his left side. So all these things people think it's because of patient's carelessness. It's not the case. This is because of the condition called unilateral neglect or hemineglect. Let me explain in a very simple way. So think of your brain as a camera. So after stroke, one side of your camera stops paying attention to one side of the world. The eyes may be perfectly healthy, but the brain simply doesn't process or acknowledge anything on one side. Most commonly after the right-sided brain stroke, the patient starts neglecting left side of the body. They may often leave food on the left side of the plate, or maybe forget to wear left slipper, or leave the left sleeve hanging, or just ignore the people who is standing on their left side. It's not because they are careless. It is simply because their brain doesn't pay attention to that side. So what should caregivers do? First, never scold the patient. They are not doing it intentionally. Okay. And second thing, start encouraging patients to look toward the hemi-neglected side. During meals, gently remind them to look at the entire plate. During physiotherapy, we encourage activities like scanning towards the neglected side repeatedly and turning the eyes and the head towards the neglected side, and encouraging the reaching activities using the affected arm whenever it's possible. Place important objects like mobile, TV remote, family photos towards the neglected side so that it encourages patient's brain to use that side again. Use mirrors during the exercises and grooming. Mirrors usually provide visual feedback and encourages the brain to recognize the neglected side. As we all know, recovery doesn't happen overnight. Brain needs repetition, consistency, and patience. As physiotherapists, we just don't strengthen the muscles. We also retrain the brain to start noticing what it has stopped paying attention to. And here's the important message. Hemi-neglect is not the problem with your eyes, it's the problem with the brain's attention. So instead of saying, why aren't you looking? Just say, let's look together. Because sometimes the greatest therapy is not forcing the patient, but guiding their brain to notice the world again.